Thank you, Madam Chair. On January 28, 2017, 3 years ago from today, I lost a friend. Dr. Shalon Irving was a classmate of mine at the MPH program at Johns Hopkins University. She went on to become a CDC epidemiologist, a lieutenant commander at the U.S. Public Health Service, Commissioned Corps. She was highly educated, financially secure, surrounded by a strong network of family and friends. She was covered by quality health insurance. She's a Black woman, and she lost her life 3 weeks after giving birth to her baby girl, Soleil, her first child. 3 years after that tragedy, we are here to address a crisis that cuts across education levels, income brackets, geographic regions, and type of insurance. Moms and babies are losing their lives at unacceptably high rates in the United States, and families like Shalon's are left picking up the pieces. The name of today's hearing is Expecting More. And when it comes to America's maternal and infant health crisis, we need to expect more. We need to pay more attention, take more action, and make more progress. Ms. Stewart, through your work leading the March of Dimes, you've heard too many stories like Shalon's in America. Why are protective factors like education and wealth failing to insulate American moms from elevated risk of maternal mortality and severe morbidity?
So first of all, I'm very grateful that you tell that story and that you celebrate the life of your friend who unexpectedly and wrongfully is passed away and unfortunately is no longer with us. And I think the point you're raising around the maternal mortality rate for Black women, as it relates to no other issue other than the racism that they probably experience as a result of their healthcare experience, is really one of the most critical issues that we have to talk about in this country. The fact that we can look at an educated Black woman and she dies at a rate that's 5 times more than her white counterparts is just simply unacceptable. And if it's not due to their income level, it's not due to education levels, not due to medical coverage or healthcare coverage or insurance or all these things, then what else is it? It has simply to do with how they're being received and treated by the system where they're expecting to receive quality care and the system is failing them. And so I think part of what we're doing at the March of Dimes is acknowledging and working with many partners to say, what can we do as one participant in the system to change these kinds of outcomes and to help the system realize that there is implicit bias in the system that medical providers, though they don't intend to, are making judgments about Black women, and are then therefore causing Black women to receive inadequate care, often putting their lives at risk. And so part of what we're doing, just one of the things that we're doing is, in addition to having an entire health equity approach to our work, is looking at certain programs like introducing an implicit bias program. Dr. Claire Perry talked about the work she's doing in that space. Yep. We've worked with an organization to create a whole new implicit bias program for many of our hospital and other healthcare provider partners to make sure that they are aware of the implicit bias that they may be experiencing on a daily basis, that it's actually influencing the lives of the patients that they're attempting to serve.
Yeah, putting their lives at risk.
Absolutely.
Earlier this month, the Commonwealth Fund published a report showing that the Affordable Care Act narrowed racial and ethnic disparities in insurance coverage. And we know that in the context of today's hearing, coverage leads to better outcomes for moms and babies. And yet, as we speak, the Affordable Care Act is being threatened by a Republican repeal lawsuit. Ms. Stewart, what is at stake with this reckless attack on health care, and how could it exacerbate existing racial and ethnic disparities in maternal and infant health outcomes?
So we know that the ACA has been an incredible support to expanding coverage for so many women. And it's especially true for women of color who have, where their rate of women that have qualified under ACA has it's grown at more than twice the rate of women overall between the period of 2013 and 2015. And what this has been doing is allowing women to access the care they need. Again, to talk about this issue is really to underscore the importance of women getting the kind of preventive care they need before pregnancy and during pregnancy. The fact that many of these women of color, have more access to the kinds of coverage that is available to the ACA, especially because of essential health benefits being involved. So no cost sharing applied to all kinds of well women visits, all kinds of prenatal care visits that are really essential and incredibly important. You know, we still look at prenatal care visits and still know that too many women are not able to access the kind of prenatal care that they need. If ACA is removed, if they don't have access to being able to get the kind of health coverage that the ACA provides for women, especially women of color, we are likely to see a worsening of outcomes for those women and a worsening of outcomes for their babies. It simply would be devastating to so many of the families that we're trying to serve.
Thank you.